of Health, and the Cabinet Subcommittee, as I understand it, covers a wide range of issues, including general expenditure, the HSE implementation plan, the development of primary care and community systems, mental health provision, pay and agency costs, and there are other matters as well. So I know that the Taoiseach is forbidden to report on conversations had by the Cabinet Subcommittee on Health, but recently, in January, the Minister of Health brought forward his 25 health priorities. And given that the last meeting of the Health Committee was in May, could you indicate if those priorities were discussed? And I do recall, Concolia, the Taoiseach telling me beforehand that the big challenge for the Minister for Health is to stabilise the health system in order that it can deliver the results that we expect. I'd like to ask the Taoiseach, given what's happening within our health system across a range of disciplines, does he accept that the Government's general health policy is failing, and that this committee also is failing because the difficulties within the health service are increasing? They're not decreasing. We have the difficulties around persuading doctors to buy into the under-6s cover, which the Government promised to have in place in July. We have today 395 citizens on trolleys. In my own constituency, in Our Lady of Lourdes, there are 37 citizens, and that's the second highest in the state. And these are the type of figures that you would usually associate with the winter months. The Government has failed entirely to end this scandal, and I was in Our Lady of Lourdes just last week, and it's obvious that the staff are doing their best and everyone involved in there is doing their best, but there isn't a capacity given the number of nursing places that the Government have scrapped and the number of beds that the Government has scrapped. We have also end of April, 412,422 citizens on the outpatients waiting list, and 72,000 of them have been waiting for more than a year. These clearly are unacceptable figures. And I believe, and we've asked here a number of times, will there be a supplementary budget for health? We've never got an answer, but it's expected that HSE will be over budget by at least 100 million for the first 3 months of this year. And I'll conclude on this point, and it's a crucially important point around mental health services, or the lack of mental health services. And this month sees a green ribbon campaign to get people talking about mental health, and I don't think there's a family in this state or across this island who doesn't have a story to tell. But austerity, the economic crisis, government policy have all had negative impacts on these services, including mental health and well-being. So there are big gaps that have been created by dint of government policy, and HICWA's recent report on the safety of services in the Midland Regional Hospital found that the hospital wasn't governed, resourced or equipped to provide the 24-hour, 7-day acute surgery, accident, emergency and maternity services that are required. So, I know that the Minister, on behalf of us all, has extended solidarity, and I do that again today, to the families who were bereaved, and I commend them for persevering to get the truth about what happened in Portlaoise. But when HICWA says that patient safety was not a priority, and then goes on to say that there are similar sad and serious cases at all HSE sites, perhaps, Concolia, the Taoiseach would give us some indication of what the government's doing and how this health committee is responding to what is an actual crisis in our health services.
Thank you. Taoiseach. Thanks, Deputy. Well, the situation is that the Cabinet Committee on Health is not the government, and obviously the opportunity presents itself during the course of Cabinet Subcommittee meetings to have updates and progress reported by the ministers who are involved, and to request details of whatever issue might be there from the personnel involved with the HSE. Now, you've asked a number of questions that are relevant indeed. In respect of the question of dealing with beds and all of that, there's a new modular ward coming on stream this summer in Our Lady of Lourdes, which will deliver 20 beds there. In respect of the under 6s and the over 70s GP care, that will be introduced this summer as planned, and people are signing up there. The question of the fair deal waiting times are now down to 4 weeks and will be maintained at that level for the remainder of the year. As Deputy Adams is aware, that's down from 18 weeks, which was unacceptable. The question of the numbers and trolleys are still high. It's a problem, but it's easing, and the situation is much better than it was. Well, it's not acceptable to us yet. The private sector are now being employed where that's possible to reduce the very long waiting lists, and I can give you some details of the Emergency Department Action Plan, which was published in April. There were a range of times experience to date. It was decided to allocate 74 million on a strictly ring-fence basis. I've referred to this before. 44 million is being allocated to the Nursing Home Support Scheme, providing an additional 1,600 places and reducing that waiting time from 11 to 4 weeks. Coupled with the normal weekly release, this particular funding allocation has seen the number on the national placement list fall to 476 as of May the 15th, with the waiting times reduced to 4 weeks from that date. So since April the 2nd of this year, more than 1,800 people have been approved for funding under the NHSS. There was 30 million of cover provided to cover the cost of additional transitional care beds and additional home supports, both of which can provide people with viable alternatives to acute hospitals. The temporary transitional beds currently in use to address emergency department overcrowding will be replaced with sustainable, more effective beds under the Fair Deal scheme. In addition, for Deputy Adams' information, a further 173 community care beds will be made available around the country, which can be opened on a short or longer term basis and as a mix of short stay, rehab or long term care. Of these, 110 beds have been opened in district hospitals, with a further 24 beds being opened at Moore Hall in County Louth. In addition, 65 beds are being opened in Mount Carmel. 15 of these are now available, and this will increase on a phased basis to the 65 by the end of next month, the end of June. So this will provide more flexibility and improve the flow of patients out of hospital. I can call out an earlier point. That additional funding comes on top of measures that were already taken in the budget for last year, when the government provided €25 million to support services that provide alternatives to and relieve pressure on acute hospitals. That will enable the HSE to deliver upon the Minister's stated objective of reducing the number of patients with delayed discharges by 1/3 to less than 500, and the number of patients on trolleys in emergency departments waiting for admission for over 9 hours to fewer than 70. The benefits should have an impact within a relatively short space of time across acute hospitals and across the social care services. The HSE commenced work immediately on these objectives. Now, the HSE, on the direction of the Minister, have the capacity to recruit where it's necessary to deliver frontline services. Arrangements are in place in the HSE to allow the recruitment of such staff where it has been established that there is an urgent service requirement. And figures show that there were, as of the 19th of May, there were 668 delayed discharges nationally, which was a fall of 100 from March of this year. And a number of additional measures for Deputy Adams' information. All hospitals open overflow areas on an ongoing basis with up to 300 additional beds open. Such overflow areas include day surgery, with clearly curtailment as a consequence in day surgery activity levels. The diversion of patients with private insurance to private hospitals where consultants have admitting rights. The optimisation of weekend discharges. The optimisation of level 2 hospitals to decongest emergency departments, and this was particularly effective in the Louth Meath groups. Non-urgent elective cases were curtailed where necessary. The expansion of the community intervention team services to Naas and to Our Lady of Lourdes, and these escalation measures will remain in place, and the daily oversight arrangements at national hospital group and individual hospitals will continue. Clearly, the Minister has given the HSE very clear understanding of the necessity to control costs and to have management exert its responsibility in managing these costs in hospitals. Not always possible, but it's an opportunity for the Cabinet Subcommittee on Health to have reports and updates on the progress being made in all of these different areas. So it's good news to report in some cases, Deputy Adams, not in all cases, but believe me, the Department, the HSE and the Ministers are working very hard in that regard.
Thank you, Deputy.
Thank you.